I won't tell you which store. So now, let's assume we'll stay below 200 millisievert. Suppose 1 millisievert per hour, you don't stay there for 200 hours. That's a rule, okay? We are talking about microsievert. Actually, less than microsievert, 0.5 microsievert. So 2/1000 to 1 smaller than even 1 millisievert. Then you have to multiply 200 on it, right? So in scuba, at the moment, I'm not going to tell you to get away now. It is so goddamn small, if there were not accidents, people would not even notice it. Really. This is a number we measured, all right? We have our detector. Now, another number I can tell you was at the peak when we had about 0.7 microsievert. Yesterday, the peak, we estimate the same thing was measured at Tokai village, which is about 70 kilometers north. That's where our associate laboratory is. There, they had about 6 microsievert. So 10 times more. So this is a dilution in a way. Because of the distance, it does diffuse and get lower. So the story is something like, suppose you get the vicious leopard walking around in Fukuoka, which is about 1,000 kilometers away. You are not going to shut down your house and lock up the door and suck the the food. So it's a matter of distance. Now from the number I see from the 3 Mile Islands, 1979, if you are within about 10 kilometers, I'm sure I recommend you to get out. It's too close. If it's 100 kilometers, well, probably you don't really give a damn. Now we are 170 kilometers away. And the measured value proves that it's practically nothing. I mean, we see it's there, but it's so insignificant at the moment. So the hard facts, the measured number tells you at least we are not in danger at all. We are more in danger of human factors. Because some people rushes to buy water so that the people who need the water could not get it. Some people rushes to buy the oil, therefore some people could not get the heat in the refugee camp. I would think those human factors are far more dangerous at the moment. And if I were you, we would try to help the people suffering. If it is in a dangerous condition, I'll certainly tell you to get away and go to a safe place. But this is far enough to worry about the people who is suffering rather than yourself. So I have told you that don't trust the government announcement, don't trust the television, don't trust the specialist. But the number we see here, actually measured, is so small. Some of the government announcement is correct and so-called solid angle. The distance you go, anything dilutes. You can have a very nice LED light, and I'm not going to shine it into your eyes because that could be dangerous. But even this 470 kilometers away, no one is going to notice it. It diverges, right? Since, as I said, I'm not a specialist of radiation because I've been out of the radioactive material research type experiment for over about 30 years. But what you can do is trust the hard number, the facts you can trust. And also, one thing you have to trust is most of the rumors are unfounded. Now, as I said, human factors. In our laboratory, since the non-Japanese people living in the apartment cannot get any drinking water. But then, I mean, we are trying to support as much as we can. And we don't have enough electricity, which they are using the electricity from their generator, but we don't have very much oil left. So under this condition, we recommended non-Japanese people, if they can, better to go home. Because if the water situation, electricity, or those food situation gets worse, we may not be able to do sufficient help for those people. It's not the radiation. It's the human factors. And if you think about the damage done, over probably 15,000 lives lost, tremendous number of houses destroyed, and a big oil factory in north is totally destroyed and burning. Yes, we will have a shortage, like it or not. And this is a human factor, and I can't control it. And the Ninomiya house people are really nice people, working very hard to take care of everybody. I'm not sure if they can take care of themselves because of their taking care of you. They are very hard working. So that would be the only reason I would suggest you to leave if you want. And of course the chances are if you rush into the plane and the plane may crash and you die. Who knows? Come on, when I went to a particular country for a conference, when I see a small airplane, I'm not going to tell you the country, I thought this is the end of it. It was bloody dirty, and I don't think it was well maintained. Neither the cost of the life is so low when the plane is crashed, and if I'm happy to be barely alive, not dead, I don't think I'll get enough medical care. And of course, Ibaraki is one of the famous places to have a very high traffic accident because they are color blind. They go through traffic lights when it is red because they think it's green.
Including the bus driver.
That I don't know. It could be. So here's the message. I'm not going to decorate. I'm going to not tell you anything extra. The one fact you can trust is that our radiation level in this town is so bloody low. It's only twice as much as normal. Not 1 million times more, which you worry. Right? So this is what I can tell you. Any questions? Yes?
So I am concerned about the exposure to radiation between adults and kids. So are they equally affected, or are they kids are going to be affected more compared to adults?
As I said, I'm not a specialist. So it is going to be my assumption that the human tissues are basically the same except for the size. And a possibility of, the speed of refreshing the body cells and things So I would think that little baby would be not very much different from adults. Yes.
Children are still developing, still cancer is more effective on their development, but adults are pretty much finished growing, so that's why it's less effect. I can answer that just a little bit. I heard it from
Yes.
the sources like Zachariah from the University of City. So that's
Okay,
why-
if anybody is here, please answer me. Answer it for me instead of for me or for everybody. As I said, I'm not a radiation specialist. Yes.
I have two questions. One of them was related
Yeah.
to the same question. Before these questions, I'd like to thank you for your information. I think it's helpful for people to know what they are talking about. But my concern is not about Ohtsuka. We have relatives in